Hi, it's Georgie, and this is Fempower Health Audio Insights, where I break down the biggest issues in women's health so you can navigate the system with confidence. Whether you're a patient, policymaker, or provider, these insights give you the power to make informed decisions. So today, we are going to discuss what your doctor might not be telling you about fibroid treatment. And hysterectomy isn't the only option. So we're going to talk about these latest insights on fibroid care from top experts and learn how to make informed choices about your health. Now, I do want to preface that a lot of this discussion is based on some of the surgical interventions, which may not always be needed for you. And in some cases, you don't even need treatment for fibroids, and you may just need to be monitored because just because you have them doesn't necessarily mean they have to be removed. So that's a discussion for you and your doctor. I am not here to give you medical advice, but what's really important to know is that there are options, and there's a lot of complexities in our healthcare system, making it such that women may not fully be aware of them. So that's what we're really doing here today. Okay, so let's backtrack. Uterine fibroids are the most common, solid, and symptomatic neoplasm in women, and it affects up to 70 to 80% of women by age 50. So again, as you can see, a lot of women are impacted, but not all of us necessarily need to have treatment from a surgical perspective at least. So they are also the leading indication for hysterectomy, a definitive and effective treatment when appropriate. So again, remember, when appropriate. So the American College of Obstetrician and Gynecology guidelines have evolved in recent years, and they really move away from this hysterectomy default for actually many women's health conditions. But there is concern that women are not consistently informed about the full range of options, including for uterine fibroids. So that's why we need to talk about this. And many of the alternatives can actually help women avoid major surgery, help preserve their fertility, and reduce recovery time. So to explore this topic, I took information from discussions that I've had with Dr. Mark Schiffman, who's co-director of Weill Cornell Medicine's Fibroid and Adenomyosis Center, Dr. Jessica Opoku-Anane, who's a minimally invasive surgeon at Columbia, and Tanika Gray Valbrun, the founder of the White Dress Project. And their insights underscore the importance of empowering women to make well-informed decisions about their care. So let's talk about what uterine fibroids are in the first place. So they're a non-cancerous growth of muscle tissue in the uterus, and they can vary widely in the size, the number, location, and they can cause symptoms like heavy bleeding, pelvic pain, urinary frequency, bloating, constipation, painful intercourse, and fertility challenges. Now, I know that's a long list of symptoms, and quite frankly, many women's health conditions do have these symptoms, which is why it's important for you to monitor the symptoms, when they are happening, what makes them better, what makes them worse, and just bring that to your doctor so you guys can figure out how to rule out what you may have. But let's just presume you have uterine fibroids, and that's really what this discussion is. So again, there are multiple options to treat them, but let's explore the surgical and minimally invasive ones first. So first, let's talk about this issue with a hysterectomy first approach. So ACOG Practice Bulletin on Symptomatic Uterine Fibroids emphasizes hysterectomy as a definitive treatment, but it also highlights the need for alternative management options for women who wish to preserve their fertility or avoid major surgery. The concern is that this could still imply that hysterectomy should be first-line treatment. And in fact, according to an online survey conducted by Harris Poll on behalf of the Society of Interventional Radiology in June 2017, 20% of women think hysterectomy is the only treatment for uterine fibroids. The survey also showed that 44% of women diagnosed with uterine fibroids did not know about uterine fibroid embolization. And despite its recognition as a first-line treatment for symptomatic fibroids since 2008, Dr. Schiffman expressed concern that this lack of awareness has led to an over-reliance on hysterectomy, often without fully exploring other options. And this can have long-term adverse events on the health of these hundreds of thousands of women each year, including risk of cardiovascular disease. So let's follow the money and talk about the role of reimbursement and structural barriers, which can help us understand why we may have some of these other options presented to us, but not have all the right ones presented. So, when asked about some of the reasons as to why gynecologists are not informing patients about a less invasive option, Dr. Schiffman noted that it's a multifactorial issue. So in addition to an educational component and concerns about fertility, Dr. Schiffman shared a revealing story. Financial incentives and specialty structures can strongly influence the treatment women receive. He noted that early on when building his practice, he often had to campaign with OBGYNs about the benefits of considering uterine fibroid embolization. The alternative would be spending daily morning routines before going to the office with patients who were admitted or had complications for more severe surgery, such as a hysterectomy. And that time could be better spent elsewhere, including seeing more patients. So in other words, he had to convince them that it's actually better for the OBGYN if they just referred them out to an interventional radiologist to have this procedure done. So let's talk about how reimbursement affects decision making. So first, there's reimbursement bias. While doctors do take an oath to first do no harm, factors such as busy schedules, established practices, and systemic structures may inadvertently influence their decision to perform a procedure rather than refer a patient to another specialty. The way reimbursements are structured can inadvertently reinforce this behavior, as certain procedures like hysterectomy may be more familiar or accessible to the provider. This dynamic underscores the importance of multidisciplinary care and patient education to ensure all options are considered. Then there's specialty silos. Traditional care structures often isolate specialties like gynecology and interventional radiology, making collaborative decision-making rare, and this can leave patients unaware of non-surgical options like uterine fibroid embolization. And in fact, more level B procedures, such as radiofrequency ablation, are performed annually in this country than uterine fibroid embolization, despite long-term randomized prospective data on efficacy and complications. So, there's a solution here. It's a collaborative one, and that's by way of multidisciplinary care for uterine fibroids. So, to address some of these challenges that I had just described, there are centers like the Weill Cornell Medicine Fibroid and Adenomyosis Center and UCSF's Comprehensive Fibroid Center, and they've adopted a multidisciplinary model. So their team includes interventional radiologists and minimally invasive gynecologic surgeons, ensuring that the focus is on the center's overall performance, not the incentives of individual specialties. This approach allows patients to receive comprehensive counseling on all available options and individually tailored treatment recommendations. Dr. Schiffman emphasizes that structural changes like this are essential for improving informed consent and empowering women to choose the best treatment for their unique circumstances. However, an important point to note is that access to such specialized centers isn't always realistic. Geographic limitations, insurance barriers, and systemic inequities can make it difficult for many women to receive comprehensive, multidisciplinary care. This underscores the need for greater awareness, patient advocacy, and policy changes to expand access to diverse treatment options beyond hysterectomy. So if we look at all uterine fibroid treatment options, it's vital for women to be aware that there are many options approved by ACOG for fibroids, including minimally invasive procedures and medication. So there's the minimally invasive procedures such as uterine fibroid embolization, which typically involves shorter recovery time and fewer complications than a hysterectomy. And there's also myomectomy, where they remove the fibroid while preserving the uterus, and this option is ideal for women seeking to maintain fertility. Then there's medications to ease pain that you may get from uterine fibroids. So those could be hormonal treatments like GnRH agonists, which can temporarily shrink fibroids and reduce symptoms. Then there's non-hormonal options such as tranexamic acid, which are available to manage heavy bleeding. So at the end of the day, we really want to be advocating for better informed consent for uterine fibroids. Advocate Tanika Gray Valbrun, who is the founder of the White Dress Project, which I mentioned earlier, she stresses the importance of informed decision-making, which was the opposite of what her own experience was. She stated, "I was offered a hysterectomy the very first time that I was going to see what my treatment options for fibroids were." She also notes the disproportionate impact of fibroids on Black women and the urgent need for more equitable research and care. And then Dr. Opoku Anane echoes this sentiment. "You should not be suffering with your periods in any fashion. Most women don't present early enough, and once we actually treat the fibroids, women always express, 'I wish I would have done this earlier.' So if you are thinking that maybe this is normal, it is not. That's the time to go in to see a doctor." So for those considering or needing a hysterectomy, however, it is sometimes the best or the only option for women with severe fibroid symptoms. However, it's essential that the decision-making is made with a full understanding of the procedure and its alternatives and its long-term impact. And I actually did a detailed article on hysterectomies and what doctors don't always tell you, which has been incredibly popular. So I'll make sure I link that in the show notes, along with the written version of this episode that I just shared with you. So moving forward, this is the call for change. Women deserve to have all treatment options presented to them so that they can make better decisions that align with their values, priorities, and health goals. Together, patients, providers, and advocates can push for a healthcare system that prioritizes education, innovation, and equitable access. I hope you enjoyed this episode today, and if you have other topics that you would like me to cover, I would really appreciate your feedback. You are more than welcome to send me a note at info@fempower-health.com. And if you have feedback on this episode as well, please share that. And again, I know this was a lot of information, so please do check out the show notes if you wanted to read it. But I know not everyone has the time to sit and read articles, and so that's why I'm doing these as podcast episodes as well, to meet your needs and how best to listen. So thank you again, and have a wonderful day. Thank you for joining me today on Fempower Health. If you'd like to continue the conversation, please follow me on social media. I am most active on Instagram, LinkedIn, as well as TikTok. You can also subscribe to the weekly newsletter if you want to stay off social media to get the latest and greatest updates. And you can find the link to that either on my website, fempower-health.com, which is a hub to all the different health topics I've covered over the past 5 years, or you can go to the show notes where there's links to all the helpful resources that are relevant to this discussion. And if you know of someone in your life who would benefit from this information, please do pass this along, because that is how we can ensure this important information reaches those who need it most. And for anything that is discussed medically, please understand that none of what we share on Fempower Health is medical advice. It is all for information purposes only, and only a conversation between you and your doctor can give you the care that you need. Thank you very much.